When we get your lab results back, they're reviewed by me and a physician, and if they're all within normal limits, I will post them to the portal and you can review them at your convenience. However, if you're someone that likes to get a phone call to have this information, just let me know and I'll make sure I call you with these results. Now, if you have an abnormal lab result, you'll automatically get a call from me, and we'll review what's abnormal and what needs to be done. Typically, it's your complete blood count reflects anemia and you might need an iron supplement, or perhaps your 1-hour glucose test comes back abnormal and you need further testing. And I'm going to ask Dr. Cahan to step in here and talk to you about the importance of following up with the 3-hour glucose tolerance test and why it's important to do so, even if you miss the result by 1 point.
Patients don't like to hear about abnormal results, and these parameters that we use are set by our college, the American College of Obstetrics and Gynecology, and they're not negotiable numbers. There has to be a cutoff. So if your number comes back 1 or 2 over, please be compliant with the additional testing that's necessary. Perhaps the next 80 to 100 years of your child's life depend on it, so we got to get it right. So if Amy calls and says, you know what, your glucola is a little bit high, the results suggest that you might have an underlying problem with gestational diabetes and more testing is necessary, it's a hassle, we know it, but it's important. It's very critical that when we identify a potential problem in your pregnancy, that we do everything we can to prevent anything from happening to your baby.